METELLA Road Family Practice, located in Toongabbie, provides systematic care and chronic disease programs to complement the general practice. The provisions of these programs, with the assistance of WentWest, have allowed METELLA Road to create a culture of primary healthcare with their patients. Having a dietitian and psychologist on location allows METELLA Road to offer their community better patient outcomes through a highly skilled multidisciplinary team.
My name's Toby. I'm a GP at METELLA Road Family Practice in Toongabbie. I basically work as a doctor looking after patients in general practice. Yeah, I own the practice. I initially bought into the practice with another doctor, but he's moved on, and so I've now taken over the practice 100%. I'm pretty much the sole practitioner. I've got another doctor that comes in on Wednesdays and she helps out. She works full days Wednesdays, but it's primarily myself. The practice, we basically cater for all age groups, so we see pediatrics, adolescents, adults. We've got a program for diabetics, asthmatics, people with ischemic heart disease. We do a general recall for patients over 75, just to do a general assessment and to screen them for any medical problems. And we also see a lot of children, do immunisations and 4-year-old checks. It's primary care, it's preventative medicine, it's picking up things before they become an issue or a problem, and staying on top of conditions. When people have got chronic conditions, we really want to stay on top of their condition, make sure they don't develop complications or problems.
My name's Priya, I work for WentWest and I'm the Practice Partnership Coordinator for METELLA Road. METELLA Road has now hired a practice nurse which has been around for a couple of months. Before that it was just Dr. Nasser looking after his patients, so having a big patient base was obviously probably a little bit harder to maintain that chronic disease patient base. Now that Robin has come in, she's helping him with a lot of things, in particular like the diabetes cycles of care, the reviews, so she's able to maintain that patient base of chronic disease as opposed to the whole thing just ideally being on Dr. Nasser. So Robin also does a lot of things like diabetes reviews, and there's machines in there to check the patient's lungs, so I guess that helps those COPD patients as well. She does a complete health assessment with them as well. So at the end of it, if a patient can be looked after more holistically, even through a practice nurse, then that's something that's viable for every practice, and especially for METELLA Road as well. Robin's very, very loved around here, so it's a good thing.
My name is Robin. I'm the practice nurse for METELLA Road Family Practice. Apart from the, sort of nurse type things, doing blood pressures, wound dressing, ECGs, taking blood, we also help support the doctor, provide complex and chronic care for our patients. Well, it's all a teamwork anyway, but it's all to make sure that the day flows well, that the patient comes back for their recalls, that they get the things they needed to do to provide the best possible care to our patients.
My name is Marilyn Williams. I'm a practice manager at METELLA Road Family Practice. This practice to me is different because we are a family practice and we like to be a happy family practice. We respect our patients and do as much as we can for them. Dr. Nasser being a very good doctor, very caring to his patients, we like to support him as much as possible. One of our main areas is chronic disease, and diabetes of course being primary. We have a really good recall system where we remind patients by letter every 3 months for their HbA1c and also annually for their fasting bloods. Systematic care is very important because it's actually telling you, giving you the information. If it's left to us looking at manually, then it's so difficult and things get missed. But by having this technology, we're having up-to-date information all the time and we can act on that immediately, and our patients get much better care because of it.
For those patients with chronic medical conditions, it allows us to prevent complications. So we pick up things a lot earlier than what we would if we weren't doing systematic care. We're recalling patients on a regular basis so that we're making sure that we're staying on top of things. If complications do arise, we're able to deal with them a lot earlier and a lot sooner. And just patients feel more, they feel better looked after when they know they're having things done regularly. And they're seeing the nurse, they're seeing myself. We sometimes have, we've got a dietitian that comes in, we've got other allied health that support us as well. We've got a checklist that we work through, and we show that to patients so they can see that as they come in, all the things have been checked off. So they're not feeling neglected, or that things in their care haven't been, have been overlooked. And I think that helps patients, because then they tend to come back. And it builds up a good rapport between myself and the patients. And then they feel that they've got, they're better looked after in that respect. And that we're sort of doing a bit extra and going out of our way to help the patients.
Okay, my name's Josie Campbell, and I'm a part-time practice manager. I job share with Marilyn Williams. She works in the afternoon and I work in the morning. Our theory is that if we don't look after the doctor, he can't look after us. So we try and make things as easy as possible for him so he doesn't have to worry about accounts, patients, things like that, phone calls. Okay, our chronic disease management, we're pretty active in it in this practice. The biggest group at the moment would be our diabetics. We have a great recall and reminder system, our practice nurse, and of course our program, our best practice program, enables us to look at a glance about who hasn't had a cycle of care, which patients need their bloods done, which patients need care plans put in place, home medication reviews, things like that. Well, it enables, for one, the practice to run smoothly and better outcomes for the patients as well, so they don't come to us when they're really sick. We're able to keep them well, and we try and educate them so they can look after themselves as well. We call ourselves a family practice. All the staff get on really well together. We all do our job really well, and we all cooperate with each other, mainly for the patient outcomes, but also so the practice runs smoothly.
I think since we got the services of a nurse, and WentWest have come out and installed a pencat extraction system for us, and they've given us a lot of training and a lot of help in that area. I think now, I didn't realise how much we were lacking until they've come in and shown us that. And having the nurse on board, it's really helped. And even the reception staff, they have to do a lot of the recalls, and it's basically so the whole practice is working together to recall these patients and to get on top of things. So, I mean, initially I thought we were doing well in that, but when you actually see the numbers, you don't realise that there's a lot of room to improve. The pencat program is a program that allows us to analyse our data, or our patient database. So we can manipulate in a few different ways. It allows us to see what percentage of patients, for example, a male, a female, aged a certain age, what conditions they have. And then we can break that down further and look at our diabetic patients, for example, and see how many of them have had a HbA1c done in the last year. And then we can break that down further to see how many of them are to target and who isn't to target. And then what we can do, we recall patients who aren't to target, or if they haven't had a HbA1c done in the last year, for example, and we will do the test. So it allows us to break down that data and look to see if we're reaching targets in the different areas. So I mean, it's extremely useful program. And a lot of times, unless you run the program, you don't realise how good or bad you're doing in certain areas. And the other good thing with it is it's allowed us to see such an improvement. Since WentWest got involved, some of our figures have gone up dramatically. I mean, having the nurse there, she does a lot of the things, the observations, taking blood pressure readings, pulses, measurements, and it frees up my time then to deal with the actual problems that the patients are coming in with.
So in terms of pencat assisting the practice, what it does is it extracts a whole lot of information, de-identified information when it comes to WentWest, that is, and we assist the practice in doing things like, for example, health assessments based on the patient base. So if they have a lot of 45 to 49-year-olds, we might look at perhaps setting up a clinic for the practice. So ideally then, again, it would help with their PIP payments and their incentives in that respect. Otherwise, pencat just provides a lot of information in terms of the demographics of the patient, the MBS items that the practice bills, conditions, chronic disease. Specifically with the diabetes, we look at cycles of cares that are billed, reviews, information like that.
WentWest supplied us with a pencat 2, which is invaluable because we can download the patients that are in need in the chronic health field. But WentWest also provides invaluable team effort for us. I mean, they teach us quite a lot. They train us, they provide us with all new medical health innovations that's happening, and couldn't do a lot without them, to be quite honest.
Yeah, I think WentWest came in initially when we were trying to get accreditation, and they basically took us through the whole process of accreditation. Then they've come in and helped us. When I became a sole practitioner, they realised I was under a lot of pressure and a lot of time constraints. They suggested getting a nurse. At first I thought it wasn't going to be a good idea because of the financial side of it. But I mean, having a nurse has generated so much more income for the practice, and I mean, WentWest have shown me how that was going to work. They have regular programs, teaching sessions which we go to. Things on just how to do care plans, how to do medication reviews, different things that we can do to get more income for the practice. And then having done it now, all these practice incentive payments, they've really boosted our income. So I mean, yeah, they've been a great help in that respect. Just I guess for anyone who's coming into practice or who's been in practice and thinks, I mean, there's always room for improvement, and I think using people like WentWest, the people at WentWest, really makes a big difference, because there is, I mean, that's what they do, and as doctors we're too busy, I think, to you know, we've got a lot of things, other things that we have to do, and they just take a lot of pressure off, and they really guide you, and they're very, very helpful.